All right. Well, welcome everyone. I'm Chris Ingwalson, and I'm with Health Scholars, and I'm really excited to be able to present today at the lunch symposium. So, spoiler alert, I am not a physician. I am not a researcher. I'm a marketing executive, and I've had the pleasure of working in technology and marketing for almost 20 years now, and have been helping Health Scholars bring amazing virtual simulations to life in the last few years. So I'll be sharing clinical use cases for XR, as well as insights and recommendations on my own experience. So my own experience as being a patient who's undergone surgery, as a daughter who has helped her mother through lung cancer, and also a mom of kiddos that was born with complex chronic conditions. What? All right. Sorry. So in the US, we spend about 18% of our GDP on healthcare, which is nuts. And the demand for healthcare delivery exceeds supply. So issues like hospital consolidation, shortage of unskilled clinicians, and resource constraints contribute to operational inefficiencies. It makes it difficult to deliver consistent quality care to each and every patient. So, in the infamous words of Jay-Z, and if you're not a Jay-Z fan, I apologize, but in the words of Jay-Z, healthcare delivery's got 99 problems, but XR ain't one of them. When in fact, XR may actually be a solution. So, real quick, what is XR? So, XR is really just an umbrella term for augmented reality, virtual reality, mixed realities, and really any technologies, any immersive technologies like wearables or AI that contribute to a computer-generated environment. And what makes XR technology so important is that it enables virtualization. So if you're like me and you hear the term virtualization, I typically think of IT. So I start to think about, data centers or virtualizing data centers. And that's because virtualization and how it's made system and data administration for IT easier, and it's really dominated the conversation in recent years. But virtualization has a much broader reach, and it has a reach that we all benefit from already. We just don't think about it that often. So for example, payroll. Until the late 1970s, payroll was done manually with a physical resource, and it was typically outsourced. It was slow and ripe for error, but in the 1980s, we saw the first industrialized use of computers to virtualize the process. So computers versus humans can now do the computation, and it moved the physical process into software, increasing efficiency, accuracy, and effectiveness. So now a single person can basically handle all the HR and payroll operations for a business from their phone. So XR technology is simply the next evolution of virtualization. XR can turn physical resources, activities, and experiences into software, collapsing the distance between information and people, as well as insights. And for healthcare delivery, virtualization is our opportunity to make business processes more efficient and effective. So business processes that can make employees more productive, it can give clinicians the opportunity to focus more on patient interaction, communication, and outcomes, and it can provide patients better therapies and resources to empower their own care. It can also make the general public safer. Other enterprises already get this concept. So automotive, manufacturing, utility, they're all heavily investing in XR technologies to improve business processes, and they're also seeing the results from it. So for example, a study was done last year by Capgemini, and it showed that the majority of companies who were investing in 2 or more AR/VR projects were yielding over 10% operational benefit in areas like increased efficiency, productivity, and safety. So how can we virtualize the business process of healthcare delivery? Let's start by looking at clinical education and training and some use cases there. So for clinical education and training, research has proven that hands-on experiential learning is best, and that short, frequent training improves retention. The problem is that healthcare is missing the ability to scale experience-based training with the tools that exist today, like e-learning or physical simulation. So what XR technologies can do is it can virtualize the hands-on experience. It turns training into software, and it enables educators to now deliver the business process of immersive training at scale and with greater frequency. So an example is in-hospital cardiac survival rates are only 26%. So not great. But we know that patients in which clinical staff have good resuscitation training have greater than 3-fold odds of better survival rates. So this is why we have ACLS training certification required for clinicians every 2 years. But we also know that research shows knowledge of the life-saving competency decays within months. So health systems are aware that refresher training for this is needed, but they struggle to implement cost-effective and adequate refresher training due to the number of learners that need to be trained, limited amount of resources, and the constraints of bulky and expensive equipment that are needed to do hands-on training. So this is why our company began to look at virtual reality. So how could we virtualize refresher training? So using VR and voice technology, we've been able to basically recreate a team-based training experience where the learner plays the role of a team lead in different ACLS cardiac scenarios. So I'll show you a quick demo.
Look directly at me and say hello.
Hello.
Hello, my name is Michael, and I'll be your guide today for a sneak peek of the Health Scholars ACLS VR training app, a new way to validate and refresh competencies for identifying and managing the ACLS core rhythms.
He's not breathing.
I think I still feel a pulse. Hold on. Actually, I can't tell if it's a pulse or if it's my fingers.
Maybe. I can't tell for sure.
Let's defibrillate the patient.
Charging.
Starting compressions.
All clear. Shock delivered.
Resuming compressions.
Aaron, let's give 300 milligrams of amiodarone.
Giving amiodarone, 300 milligram IV push.
So by us virtualizing this process and moving it into VR, the training's streamlined. So we can provide refresher training at scale and for about 50% less than the cost of a physical simulation. So it saves learners time. Typically, a clinician may need up to 2 hours to travel and then complete the simulation, and that really includes only about 20 minutes of hands-on simulation time. But with VR, the simulation can now come to the learner, and they can complete it in about 30 minutes for the same amount of hands-on experience time. So it also has huge operational impact. For education administrators to schedule, coordinate, and execute an in-person team-based training like this in real life, it can take them up to 5 hours. With VR, it takes about 1. So what about the administration of care? Hospital care is our biggest cost expenditure. And one of the biggest contributors to hospital care is high resource or super users. So those with multiple chronic and or complex health conditions. They're only 5% of the healthcare population, but they make up 50% of the costs. And this is because of resource requirements, and they have higher than normal readmission rates. So none of this is new information, but it's why the clinical community exerts a lot of effort trying to optimize and measure the clinical factors like infection that contribute to the high cost of care. So to help identify where XR could best support hospital care and reduce costs for the complex chronic patient population, we need to take a look at the care continuum. So this is a very simplified version of the continuum, but it showcases that the goal is always to reduce a patient's length of stay, ensure competency at discharge, and adherence to post-discharge care plans. When the objectives aren't met, it increases the risk at every stage of the care continuum, and it increases the chance of readmissions, increasing the cost of care and of poorer outcomes. So the opportunity question is, how can we utilize XR innovations that are modest in size to disrupt the clinical risks impacting the care continuum and improve chronic and complex patient population satisfaction? So let's take a look at mechanical ventilation for children. So children who go home on long-term mechanical ventilation tend to experience higher 30-day readmission rates, and over 40% are readmitted within the first 12 months of discharge. Their median length of stay is about 11 days, which is an estimated cost of $50 to $120 million a year. So recent studies have shown that a standardized discharge plus simulation-enhanced discharge training reduced their length of stay, and it indicated a trend towards reduced readmissions within 7 days. So the physical simulation also provided caregivers better learning, more self-confidence, and better problem solving and teamwork skills compared to traditional training. So these are really big results that healthcare administration can't ignore and really shouldn't ignore. And imagine the impact if we could virtualize this process and this training modality. And the good news is that we can with XR technologies. So to help highlight some additional opportunities, I'd like to share my own story. So 10 years ago, I gave birth to these little monkeys up on the screen. Their names are Agatha and Eloise. And they were born with DeGeorge syndrome. So it left both of them with congenital heart defects and a variety of complications. So they very much fall into that complex condition population. And after several surgeries, Agatha passed away at just 10 weeks old. But then shortly thereafter, we got the great news that we'd be able to take Eloise home for care. The overall experience was exhausting, emotionally draining, but what I learned from it was that at every point in the continuum, there were major inefficiencies, and there were frustrations that could have been improved from XR technology. So, for example, within days of arriving at the Children's Hospital, Agatha needed to have heart surgery. The clinical team was recommending 2 different solutions, and I can remember sitting in the kitchen of the NICU and a surgeon explaining what her physiology was and what were some of the options and how they would perform the surgery. He could tell we were getting frustrated. We weren't understanding what he was telling us, so we finally grabbed a piece of paper and started sketching out what her heart looked like, what the surgery options would be, and it helped, but we still struggled to really understand what was going on. My husband and I are not clinical, and it made it difficult to make an informed and timely decision. So fast forward a few months, and Eloise was stable enough to go home with a feeding tube, oxygen, suction, and several different medications. And I was really excited to go home, excited to have our family back together all in one place. But 3 weeks passed, and we still hadn't received the training that we needed in order to get discharged. The hospital struggled to find the various educators, the therapists, and all the equipment that were needed to train us properly. And then once we did receive training and we were cleared to go home, I left with some handouts, some big manuals on the medical equipment, and an emergency number. And I did not feel prepared whatsoever to take care of this little baby on my own. But off we went, and we headed home, and my husband immediately went back to work, which meant I was responsible for the care of Eloise as well as our 2-year-old daughter. My biggest struggles quickly became the medication management, the equipment troubleshooting, and the frequent follow-ups that we had to do at the Children's Hospital. So meds were constant. Dosing would often change after a nurse visit. Alarms would sound and I'd be unsure what for, leaving me in a constant mode of panic and trying to troubleshoot hardware instead of taking care of Eloise. And I also began to really dread the follow-ups. So dragging an infant with all that equipment and a 2-year-old in tow was never easy. And it seemed unnecessary when the clinical team really just wanted to see her and take some basic vitals. So my experience is not unique. These are typical issues that patients and caregivers face, but how could XR have helped our journey and made the care experience more efficient and a more positive one? So if we look at the in-hospital portion of the care continuum, we needed visualizations. So visualizations of physiology, plus all of the vitals and the medical data that was being collected. So it would have enabled better communication between our family and the clinical team, but it would have also helped the various specialists that were caring for our daughters and they were communicating with one another. So overall, a more complete understanding would have led to quicker and more informed clinical decisions by us, as well as the clinical team. So the example that I have up on here is Stanford's virtual heart. So they've developed their own software system that combines imaging from MRIs, CTs, and angiograms to create a 3D model so that both patient and doctor can now actually look at the physiology and interact with it. So once ready for discharge, as I mentioned, we spent weeks in limbo waiting for the training. It would have saved a ton of time and been way more effective if I could have just used an XR application to train me on how to care for Eloise, how to utilize the machines, and it would have also let me practice the skills over and over again. And ultimately, it would have tested my competency level. It also would have given data to the clinical educators on where I struggled, so that once they were ready and they did have the resources to come and train us in person, they would have known what to focus on. So an example up here is Cincinnati Children's is using VR for respiratory distress training. So it can be difficult for parents to recognize when their child is getting worse and when it actually requires escalation of care and when they need to bring them back into an emergency room or to see their primary care physician. So VR allows the parents to see a virtual baby and basically hear different breathing types so they can learn how to assess different warning signs and different breathing patterns, and then also how to administer different types of inhalers based on the severity of their symptoms. Another application could have been space planning. So for us, space planning wasn't as relevant. Our equipment was a little bit easier and more portable, but returning to our vent example, so vent patients and their caregivers have a pretty arduous process before they can be discharged, and one of them is around space planning. So they're required to have an in-home visit where someone comes and assess the right space to bring home all the ventilation equipment. They check things, like electrics, how much space you have, are you going to need special shelving, things like that. So then once they leave, the caregiver has to get all the equipment, set everything up, and then it requires another in-home visit for them to come back and approve it. And basically, this process goes back and forth until they feel like they've got the right space and the equipment's how it needs to be. So I don't know about anyone else, but I've used online decorating tools. And I actually just redid our entire bedroom using an AR application and a remote designer. So everything from space planning to visualization to then ordering the products with a remote designer. So if I can do this for my bedroom furniture, why can't we do this for planning at home? Let's see. So the last piece is then at-home care. So at-home care may have the most opportunity of all. I was constantly forgetting how to reprogram the feeding tube. So having virtual refresher training would have been a huge help for me and also helped me to troubleshoot, when different alarms or different notifications were going off and I wasn't sure and I didn't want to dig through a giant manual. It also would have been really valuable to train new caregivers, like Grandma, when she came on board to help, or nursing staff. We had a lot of different nursing staff in and out of our house, and they were constantly turning over as well. And you would think that they would know all the ins and outs of the equipment and what the routine was, but they didn't. So often I was left to educate them myself. So the example I have up on screen here is Icona. So they're in development of an AR pill planner for patients. It helps with medication management. It can help organize meds, dispense reminders, alerts, and help keep track of missed or mismanaged dosing. And I think an interesting evolution that we'll also start to see with AR medication planners is with physicians and pharmacies. So Walgreens just patented their connected care oncology technology. So this is a communication software that allows pharmacists to gather important information about cancer patients that are administering their cancer drugs at home. And basically they can then collect the data, pass it on to the patient's oncologist for remote monitoring and interventions. So I think eventually we'll see all of that come together, and now you'll have sort of a medication adherence and maintenance application through XR. And finally, the last piece that would have been really beneficial to our family is remote monitoring and consultation. So an example is the Sheba Cardiovascular Prevention Program. They have been using patient wearables, mobile software applications, VR technology for their cardiac rehabilitation program. It remotely monitors hundreds of their patients and doesn't require that they come into the hospital for their actual sessions. So it's helped increase patient satisfaction. It's also helped with physical activity compliance, and it's reduced their emergency situations. And this would have been a much more efficient way for Eloise's physicians to keep track of her progress and kind of her basic vitals and reduce my travel time, and really given me an alternative way to have ongoing interactions with the clinical team. So by virtualizing the elements of the care continuum, we can reduce length of stay, we can increase caregiver confidence, increase compliance, and also decrease readmissions. So one final use case that I want to cover is in public health, and it is around foodborne illness. So hopefully everyone has finished eating, and if not, I apologize. I thought about this about halfway through, that I'm doing this at a lunch symposium, but so foodborne illness affects 1 in 6 Americans every year, and I'm sure most of us have had the unpleasant experience of foodborne illness. But it does affect about 128,000 people and being hospitalized each year, and 3,000 die annually in the US. And the greater concern is that the numbers are probably going to rise because the proportion of people who are at risk, such as complex and chronic patients, as well as the elderly, their numbers are increasing. Plus, our food systems are becoming much more global. So an interesting example of how foodborne illness comes about is recently the USDA established a new guideline that would allow slaughterhouses to process chicken at a faster rate. So from 140 chickens per minute to 175 chickens per minute. So processes like fast line speeds in plants increase an inevitable breach. No human can keep track manually of all that of all the meat that's passing through and give it an okay. So beyond the inspection error, the other big culprits are a shortage of food safety inspection service workers, and the most common source is food prep and handling at restaurants. So how can we use XR to solve this public safety issue? So one is around the shortage of food inspection workers. So recruitment for inspection workers is pretty difficult, and turnover is very high. Often because expectations around the job aren't clear. People have different expectations of what it's actually like to work in a slaughterhouse or on the actual processing floor. So recently, the USDA has started using VR in its recruiting and training practices, and that Food Safety and Inspection Services noted that 20 to 25% of their candidates, once they have an actual virtual reality experience of what it's like to work in a slaughterhouse, leave. They don't want to go through with the job process anymore, but that's exactly what they want. Much better to have someone decide not to go through the program so they don't have to spend the costs on the training, relocate anybody, and also we don't want people on the floor who aren't engaged in the food safety and inspection process. So for meat hygiene inspection, introducing AR camera systems with AI on the processing lines is kind of a new technology that the USDA is looking at. The benefit of it is that it could help detect all those physical flaws in the meat hygiene inspection process that humans just miss, either because of the line speeds or just general human error. None of us are perfect. And the AR solutions can not only help increase the efficiency and facilitate error-free productivity, but it could also help identify, diagnose, and correct procedural pain points within the processing. And for restaurants like KFC and Honeygrew, they're already utilizing AR/VR training technology to help address their challenges. Walmart also recently announced that they're making major investments in AR and VR technologies, but including the use of teaching proper produce handling. So for restaurants, eliminating the training variation and ensuring that every new employee learns the same information in the same way is something that can have a dramatic and sustained impact on consistency, our productivity, and of course, the safety of our food. So beyond enabling more effective patient care, the thing that everyone should really be thinking about now and is a really big deal is that all of this gives us data. So virtualizing business processes now starts to measure behavior, and we can take that data to assess competencies. We can use it real time to provide clinical teams earlier warning of when an intervention is needed, or alert care teams to medication and adherence type of issues. We can also use it to assess trends that then can further improve therapies, workflows, and training for the future. So I believe that XR can make healthcare delivery more effective and efficient. It can virtualize physical resources and experiences that are in limited supply. It solves scale issues. It can provide better communication, instruction, and engagement during the care continuum. It can enable better at-home support. It can enable remote monitoring and communication, and it provides valuable patient data and analytics. So simply, it can make healthcare delivery better. I hope my story and some of the use cases that I shared today maybe gave you some new ideas or raised some new questions, and I know that I can't wait to see what XR contributes to the healthcare system in the coming years. All right, thank you, and if you guys have any questions, please let me know.